So let's take the next question. So our next question is a patient presented with a nodular swelling on the cheek with a mixed consistency as shown below. Okay, what is the diagnosis? Now the option A, that is your parotid tumor, option B, which is the dermoid tumor, option C, that is your sebaceous cyst, and option D, that is your tumor of the jaw. Okay, now let's try to look into this image. So the swelling that has been located exactly in the parotid space. Okay, and not only in the parotid space, it is basically lifting up the ear lobule. Okay, which is eventually the characteristics features of the parotid tumor. So hence your answer is parotid tumor, right? Now what is this location exactly said to us, like the parotid space? So your parotid space is basically bounded. Number one, your anteriorly there is a presence of mandibular ramus. Okay, so anteriorly there is a presence of mandibular ramus. Posteriorly there is a presence of mastoid process. Now in the medial direction, medially there is a styloid process, right? So medially there is a presence of styloid process. Okay, now in the posterior superior area, obviously there is a presence of temporomandibular joint plus external auditory canal. So you can see that, right? So somewhere here is the exact location of the, it's basically temporomandibular joint with a external auditory canal. So if it is a ramus of the mandible, okay, and here basically lies the mastoid process. Now next important thing is that here superiorly there is a presence of zygomatic arch, and inferiorly there is a presence of posterior belly of digastric. So below there is a posterior belly of digastric. Okay, and above what we get, zygomatic process. Okay, zygomatic process. Okay, now let's see in this image again. So this is exactly the same location what we are basically talking about. This is the parotid space, and there is a lifting up of the ear lobule as well. Okay, now let's try to understand regarding the parotid tumor. So obviously we have the major salivary gland and the minor salivary gland. Major salivary glands are parotid, submandibular and the sublingual. Minor are the few small minor salivary glands are there. They are basically located inside the oral cavity. Okay, now there is a excessive growth of the cells of the parotid gland that will eventually gives rise to parotid tumor. Like every other organ, we also have the benign tumor and the malignant tumor. Mostly the benign tumor basically predominates. Okay, among the benign tumor as well as the overall tumor, most common tumor that has been found in case of parotid as well as in case of salivary gland, that is your pleomorphic adenoma. Okay, now your pleomorphic adenoma is basically slow growing. Now the most common place of the pleomorphic adenoma to develop is eventually parotid gland followed by submandibular followed by sublingual, and very few examples are basically seen with a minor salivary gland which is basically located somewhere in the oral cavity in the palatal region. Okay, so you can see that, right? You can see that in this image. So this is basically your palatal salivary gland tumor. Okay, now the speciality of the pleomorphic adenoma is that it basically consists of mixed type of pathology. That means there is a presence of epithelial as well as mesenchymal tissue there. Okay, that basically makes the whole thing special. Okay, now let's try to understand what are the clinical features we might gonna see in this patient. So already discussed regarding the most common benign tumor of the salivary gland. So it basically the age that is predominantly seen, third to fifth decade, and it basically female predominant tumor, now the typical presentation, patient simply comes to you with a swelling in that particular area, and on asking whether there is any pain, the patient eventually denies for any pain. Okay, so it's basically well defined solitary lesion. It's a basically mobile mass as well, and it's a basically slow growing. So on asking the patient eventually complains of like having that same tumor or the same swelling for few years, right? So that's the typical features, the typical history the patient will give to you. Okay, now the important aspect is that the mobile mass. Okay, now let's try to understand. We have the parotid gland, and that is basically got two lobes. So one is your deep lobe, another is your superficial lobe. So let's suppose it's a superficial lobe and this is your deep lobe. Okay, now in between these two lobe we have two important structure, that is your uh, external carotid artery and the retromandibular vein. Okay, retromandibular vein, and we have the facial nerve that basically runs like this, facial nerve trunk. Okay, facial nerve trunk. So just few centimeters behind there is a stylomastoid foramen, and the location is somewhere near to the stylomastoid foramen where they basically exit and runs through that in between these two lobes. Okay, here is your facial nerve. Now you have to understand most of the tumor basically arises from the superficial lobe only. Okay, but obviously sometimes there is a involvement of the deep lobe, right? So in that case it will eventually present it to you with a paratonsillar paratonsillar bulge. So that's a inside the oral cavity there is a bulging in the paratonsillar area. So that will eventually make the patient with a much more difficulty in swallowing foods and everything. And also there is a chances, fair chances is there, the patient might gonna come to you with a breathing difficulty as well. Okay, now your sudden increase in size. Okay, sudden increase in size, and with that there is involvement of the facial nerve palsy or the facial nerve involvement, or the feature suggesting of that will eventually suggesting you towards the sudden onset malignant transformation of the pleomorphic adenoma. So as we have already mentioned, like the pleomorphic adenoma, it's a simply a benign tumor, but obviously it poses a risk of malignant transformation. Okay, so obviously we have the fair chances of that. So the malignant transformation is eventually known as carcinoma X pleomorphic adenoma. Okay, it's a basically known as carcinoma X pleomorphic adenoma. Okay, it's a basically the malignant transformation. Okay, so these are the typical features will eventually suggesting towards this. Now we have the rule of 80. What does it means? Now your 80% of the parotid tumor is basically benign tumor. Among that benign tumor, 80% is basically pleomorphic adenoma, and 80% of the salivary gland adenomas are basically located somewhere in parotid. Okay, and 80% of the parotid tumors are eventually arises from the superficial lobe of the parotid gland. Okay, so these are the rule of 80. Please do try to remember this. Okay. Now, the site, obviously, the rulability suggests that is the most common site is superficial lobe. Now, obviously, location of the tumor, I have already mentioned regarding that. There is nothing new regarding this. Obviously, the patient will come to you with a painless, slow growing, mobile, discrete mass with a sometimes nodular consistency or rubbery in nature. So, it will eventually form a dumbbell shaped tumor because if it at all, it basically affects the deep lobe, right? So let's try to understand. So this is basically your fasciovenous plana patties, this one. So this one is your fasciovenous plana patty. So that is fasciovenous plane of patty. So in between this is the plane which is basically located in between the superficial and the deep lobe, and through that there is a facial nerve that basically runs, and apart from that, there is a retromandibular vein, and the external parotid artery also runs there. Now, you can easily able to understand. So there is a tumor that has been involved in the superficial lobe here, right? So here it basically involves the superficial lobe, and also there is involvement of the deep lobe. So it will eventually goes into the inside, that is in the oral cavity, and there is a peritonsillar bulge, right? So the whole scenario is basically formed like a dumbbell of tumors, right? So this is why it basically known as the dumbbell tumor, if at all it involves the deep lobe. Okay. Now the pathology, obviously I have mentioned there is a mixed pathology has been seen. One is your epithelial aspect of the pathology, another is the mesenchymal component. So two components are basically eventually seen. So in the mesenchymal component, obviously you are able to find a myoepithelial cells here, right? So this is the myoepithelial cells has been seen. Also you can able to see the ductular cells with a background of the stroma that would be seen. So the typical characteristics is that there is a finger-like projection of this tumor. Now this finger-like projection, they basically grow with that finger-like, with the help of that finger-like projection. Now this finger-like projection left behind after the excision of the tumor is basically responsible for the recurrence. Okay. This is the main cause of the recurrence in that case. So there is a pseudopodia extension of the tumor gland into the parenchyma like a finger-like projection. Okay. Also, we have already discussed regarding the risk of malignancy, that is eventually 95% risk in 15 years, and that eventually increases over time. Now, let's try to talk about the investigation. Obviously, your initial investigation is going to be your USG. Okay. HR USG, high resolution USG, that is your initial investigation. And this USG also gives you a also helps you to get your FNAC done, which is basically done with the image guided FNAC. And your image guided FNAC is the investigation of choice in that case. Now, your CT scan is supposed to be done before the operation, because to get the idea regarding the local extension of the tumor as well as the deep lobe involvement is there or not. MRI is always there for better investigation technique regarding the extension of the swelling in that case. You might gonna find a Carten sign, a positive in that case, but you have to understand we are doing the FNAC, not the biopsy. Why? Because biopsy is basically contraindicated because it might gonna injure the facial nerve. That is the number one thing. Also, there is a seeding and high chances of the recurrence from the biopsy area that is there, and also there sometime we might you might gonna see, or we have seen uh, more cases like that. The patient eventually comes after the biopsy with a parotid fistula formation, which is eventually difficult to treat in that case. Okay. Now the treatment. What are the treatment aspects? Obviously, the surgical management is supposed to be done. You can go for the superficial parotidectomy in that case if it only involves the superficial lobe. Otherwise, you obviously you have the option for the extra capsular dissection. So you can take a normal tissue just surrounding the fibrous capsule. Okay. Obviously, your high recurrence rate is basically there due to the finger-like projection that has been left behind during the surgery. Now, let's talk about another important thing, that is your mixed malignant tumor. Just a few ideas regarding your mixed malignant tumor, because when there is a mixed malignant tumor, it might gonna present it with rapid increase in size. So the duration of the history that has been given by the patient, that will be eventually short. And the involvement of the facial nerve, more often the patient will come to you with the involvement of the facial nerve in that case. Sometimes there is the involvement of the lingual nerve that will basically causing refer uh, referred pain, referred pain, or referred otalgia. Okay. So there is severe. So there is a severe ear pain that has been seen in such patient due to the involvement of the lingual nerve, right? Also, as it is basically a malignant tumor, it might gonna involve the superficial skin, so that will eventually presented with a ulceration there, and sometimes involvement of the mucosa might gonna see as a intraoral ulceration as well. So the swelling would be pretty much hard, and there is a sudden onset of pain due to the involvement of the facial nerve or lingual nerve in that case. So in that case, we need to go for the surgery, and that is you're pretty much radical in that sense. Followed by you have to go for the radiotherapy. Followed by you have to go for the radiotherapy. Let's try to see in this image. Okay, so obviously there is a mixed malignant tumor like the parotid gland with a malignant transformation. So it's a large tumor. You can see that, and there is a rapid increase in size. Eventually, it involves the facial nerve that is there. You can see that there is a angle of mouth deviation is also being seen in that case. Now, the problem is somewhere is that it will also involve the lingual nerve. From there is a referotalgia, and there is a intraoral extension as well. Intraoral extension. So, this is your intraoral extension. Okay. So, your option A, that is going to be your answer.